Children with autism are almost always late potty trainers, and it takes a lot of effort. So today we are talking about the important topic of potty training. Hi, I'm Dr. Mary Barbera, registered nurse, behavior analyst, and best-selling author. Each week, I provide you with some of my ideas about turning autism around. So if you haven't subscribed to my YouTube channel, you can do that now. So today, I am sharing a short excerpt from a potty training podcast that is a classic rebroadcast. It is now podcast 210. And yeah, potty is just such an important topic to kids on the spectrum and toddlers and preschoolers who have difficulty. Same techniques, whether you have a diagnosis or not. And in many cases, there are underlying issues if you can't get a child potty trained, like constipation. So let's listen to this excerpt. And I think behavior analysts who read a 1974 book and are just, determined that that's the protocol they're going to use are probably need to get up with more of the current research. Okay, so prior to potty training, say you have a 2.5-year-old that is not ready for potty training, but you can do a couple things prior to potty training to get your child kind of more ready, and that is to keep their diapers clean and dry frequently. So you want to be checking them every hour or two, making sure they're not sitting in wet diapers or sitting in stool. You can comment, you're very wet, and you could and should, I believe, put your child on a small potty or on a toilet with a ring seat so they don't fall in. I would put them there in the morning, at bath time, at night, a couple times a day, just to pair it up that this is where we pee and poop. What happens sometimes with kids with autism is like people say, well, they're not ready, so we're putting that little potty away. And then when they are ready, say at 3.5, 4, 4.5, then you get out the little potty, and then it's like World War II has erupted because the child won't sit. The potty's not paired. And so I believe that even little babies who can sit, 18-month-olds or 1-year-olds even, to put them on a little potty just to pair it up, just to be like, oh, this is where we pee, is fine. The other point that is a mistake I see frequently is that boys are often taught to stand to pee, and then when they get to pooping, it's like World War II to make them sit. So I advise strongly that boys need to sit to pee at least until they're fully bowel trained. This is a mistake I see a lot, and this is the number one thing when you have an 11-year-old who pees on the toilet but poops in his pants or in a diaper, because they are not taught to sit. And if you're not taught to sit and relax, and then a lot of times the bowel movements happen by accident, and this is a problem. So, say your child is ready and you're gonna try to tackle this. I do have a toolkit that I produced years ago. I hopefully will update it in the near future, but if you go to marybarbera.com/potty, you can get this toolkit for free, but you want to select a good time to initiate training. Usually bladder control, urine comes first to get trained. The newly diagnosed period, as I said, is not really ideal. And you want to look for, preferably at home, say you're going to tackle this and you're a parent, or even if you're in an autism school and you're going to tackle it at school first and then generalize to home, which is totally fine. You want to pick like a 2-week chunk where the child's not going to be, like if it's at home, the child's going to be off. So maybe summertime, or a week or two over Christmas break, something where you're going to get some momentum.
And you can definitely train at school and at home, but it just needs to be collaborative. You also want to look ahead to the next couple of months, maybe 2 or 3 months. If you're moving, if you're having another baby, if the child's getting his tonsils out like Lucas was, it might not be worth it to start and stop. And maybe many of you listening have had a lot of false starts with potty training and a lot of, we tried, it didn't work. I've worked with kids that are 16 and not potty trained at all. And when I tried to investigate, like, was this ever attempted? It's just like a lot of false starts. So you want to make a plan so that it's not just a false start. You actually can follow through. So as I said, home is usually more ideal than school, but if it's going to be done at both home and school, I suggest that, we need to communicate and that there's a toilet training manager, especially if there's multiple environments. So really ideal, say you're in a private school for kids with autism and you're going to, do this at school. And say Amy's the teacher or the person that's going to basically take charge of it at school. Maybe Amy could then visit the home and talk about the steps that mom can take at home, and how this is going to work. Consistency is the key. The team needs to agree on words to use. It's just so simple. Like, are we going to use potty, or are we going to use toilet or bathroom? I know we have people from all over the world listening, whatever, words people use. Are we going to say pee-pee or urine or poop or poo? These words need to be discussed and decided so that everybody's consistent. We need to decide on a schedule. Most kids are schedule trained before there's any spontaneity in requesting. We need to decide on reinforcers. Some people give an M&M. Some people, they don't want to talk about food and bathroom at the same time. Some kids are really tough. I remember I had a 12-year-old that I was trying to potty train, and, he was just really, he had no language. He had really few skills and really few reinforcers. So I'm like, what could we do just to have him sit on the potty, or if he peed, what could we reinforce with? Is there anything that he kind of goes really happy about? And I remember the staff sitting around and whispering, well, no, don't tell her that. Don't. I'm like, what is it? What is it? I need to know reinforcers. And they said, well, when it rains, when people bring in their umbrellas or put up their umbrellas, he gets really excited. I'm like, a travel umbrella, that's perfect. You could open it up and twist it around 3 times, and that's his reinforcement.
I hope you enjoyed that excerpt from Potty Training Podcast 210. If you did, I'd love a thumbs up. Share it with somebody who might benefit. And for more information, you can download my free potty guide at marybarbera.com/potty. And I'll see you right here next time.